Hi, I'm Dr. Sue Mitchell, and I'm here today to review your labs to help give you some insight and help you kind of start reviewing the labs and what they mean prior to your visit. So now we're on page 3, and this is our chemistry panels. And the panel we see here is a comprehensive metabolic panel. And again, you're going to see the glucose. You'll look at electrolytes, sodium, potassium chloride, CO2. You'll see calcium. You'll also see albumin, which is a measurement of your protein stores. You'll see total protein. You'll see creatinine. That's a measure of your kidney function. You'll see GFR, which is glomerular filtration rate. That again is a kidney measure. And then we also look at liver function tests. You'll see AST, ALT, alkaline phosphatase. You'll see total bilirubin, direct bilirubin. Those are all liver function tests. And if those are abnormal, we'll talk about those in more detail. So now we're on page 4. And at the top we have uric acid. And so for men, we'd like to see it less than 6. For women, a little bit lower than that. You know, the lower your uric acid, it can be a sign that your cells are doing well. So sometimes cells will produce more uric acid when they're stressed. It can also be diet related as well. So now we've moved on to the thyroid part of your lab tests. TSH is one of the first thyroid tests that is there. And TSH is the hormone that stimulates the thyroid to start working. And the thyroid gland makes free T4, so we measured free T4, and then the active form of your thyroid is free T3. I also look at what's called reverse T3. This is an inactive form of thyroid, so sometimes depending on if a body is stressed, we'll actually convert thyroid into an inactive form. And then we also look at autoimmune thyroid antibodies. I always tell patients, just because if you are positive for a thyroid antibody, that does not mean you have an autoimmune thyroid condition. I like to look at everything, the whole thyroid picture at one time. And so sometimes patients' thyroid antibodies will be positive because they've been diagnosed with Hashimoto's in the past, but it's just nice to get a snapshot of a good overall view of the thyroid. So the next lab test is called GGT. And this is actually a liver test. And I like GGT primarily added on because it's one of the liver enzymes that gets induced by alcohol. So if people are consuming alcohol daily, you might just see the GGT elevated and the other liver function tests normal. You can also sometimes see GGT elevated with certain medications. Sometimes it's great for me to have it when I look at your primary liver function test and there might be an abnormality there. So I really like having the GGT as well with the other liver function tests. So now we have ferritin, and ferritin is actually the form that is really what our iron stores are. So iron is stored in our liver in the form of ferritin. Ferritin tells us how much iron we have available to be released in order to help our bone marrow make red blood cells. Sometimes, obviously, if ferritin is really low, then you would have iron deficiency. But ferritin can sometimes be elevated, and it can be part of inflammation. So sometimes if we have inflammation in our body, the liver will actually release ferritin into the blood circulation. So sometimes we'll see elevated ferritin, and it just can represent some underlying inflammation. If the ferritin level is really, really high, then that might warrant some other testing. But typically, ferritin's just a great number to make sure we don't have iron deficiency, to make sure it's normal. And if it's elevated, just take a history and look for other causes of inflammation. So now we're on the section of immune function, and we have immunoglobulins. We have immunoglobulin A, immunoglobulin M, and immunoglobulin G. We say IgG, IgM, or IgA. I like to see that all 3 of these levels are normal, so sometimes patients rarely are born with deficiency of these immunoglobulins. IgM can be elevated in early infections. IgG, sometimes we can see also infections, but it's typically an antibody that's produced a little bit later in the infection. And IgA is the type of antibody that is made in our mucosal surfaces. So in our GI tract, when pathogens or bad bacteria enter our gut, the type of antibody that we make is called secretory IgA. So that particular type of immunoglobulin fights bacterial in our gut. So if I saw that your serum IgA levels were low, I might be concerned that you might need some support in terms of fighting pathogens in the gut. And on the flip side, if your IgA was really high, it could suggest that maybe you're fighting an infection in a mucosal surface somewhere. So now we're at the bottom of page 4 at the hematology. This is the lab test called a CBC. The very first test I look at on the CBC would be your white blood cell count. We want to be sure your white blood cell count is normal. Next, we will look at hemoglobin, and hemoglobin is a measure of how many red blood cells you have. We also then, below it, there's the initials MCV, which stands for mean corpuscular volume. In other words, it's telling me the size of your red blood cells. So if your MCV is low, that would mean your red blood cells are small. Conditions that might cause your bone marrow to make very small red blood cells would be if you were iron deficient. If your MCV is high, that means your cells are larger, and that would make me want to inquire about daily alcohol intake. I'd want to look at your B12 levels, folate levels, because if B12 and folate are low, that can make MCV be larger, and that means that your cells, your red blood cells, would be larger. And then finally, we have platelets. And platelets are important just to make sure that we have plenty of platelets so we can clot. If your platelets were really low, I would worry about bleeding risk. If your platelets were really high, sometimes that can be a sign of inflammation or infection, but we just want to be sure your platelets are in the normal range. So then also you will see what's called the differential, which is part of your CBC, and that's looking at the individual types of white blood cells. It's telling you the percent that might be lymphocytes or neutrophils, and if any of those are out of range, we'll talk about that in more detail. That concludes your lab panel. We look forward to reviewing this in clinic with you, and also feel free to use this video, review it as many times as you want, and hopefully this will provide you some great insight into your lab data.